All right, so good afternoon, everyone. All right, so today we have as our topic goals and objectives. But before we start, I'm gonna show you the draft of the group allocation for the research project. And you can let me know how you feel about it. And we can make changes if we need to make changes. I've noted that not everyone responded to using the link. So we need to decide on those people. And I've also realized that a lot of people are not registered for the course. So please go on and ensure that you are actually registered to for the course, so that I'm talking about research methods 1. All right, so this is the draft. So some of you would have indicated working with 1 or 2 people. This is really a lot. So please note that we have to increase the size of the groups beyond your interest.
I don't really know some of those.
Hmm?
I'm assuming it's grouped based on like.
Your track, and if you're doing full-time, part-time, because I don't want to group people who are part-time with full-time people, because sometimes the part-time people don't have the best interest of the full-time people who need to get out of here in X time. So it's a lot of people, and we also have, let me just make it smaller. We also have a finite staff. There's a lot of people to supervise. All, 11 individual projects, and there are 6 groups already. We have 2 unassigned people, so I'm not sure. Tashai and Melissa Richards. Is 3 Melissas you have?
Yes.
What's it like? Melissa, all three. I'm not sure if I know Tashai. Tashai is in here, right? What else Tashai? So Tashai and Melissa Richards. I just need to know your intent. Listen very early, so find your people. And see how things are.
And my people to determine what's up.
Remember, I told you we're going quickly. So we have to make quick decisions.
Give them some physical purity.
So try and find the people through, get a phone number for them, start up a little group, and see how we can,
Based on like last year and everything. That is better when you're in a group.
it depends. So if you are the person who will sit down and do your work all by yourself and get things done, that's you. Some people may need support, especially around the field work. But just remember, as an individual going out there alone, this is your money alone, your time alone, your everything, all of your resources. Huh? Of course. Of course, anything to get it done, you have to pay us a pocket and pay somebody to do your data collection, it's all good. Up you go. Okay. If you start in the group and realize this is not for you, tell us early. And if you're, as an individual, it's really easy to do the work until you reach in the field, and that's the problem. But you can sit down and write a whole proposal. But then it comes on to the field work. So once you're prepared for that, it's all good. So how are we? I mean, I know that you don't know if you will be good, but this is the draft. Of course, we can refine as we go along. So you can let me know how you feel. Well, let me say thanks for your cooperation in providing the information. I also want to say, as you start to think about your topics, you're free to do anything that you want to do that's in line with public health. But I also wanted to highlight some of the areas that people in the department are working on. And then if you have an interest in any of these topics, then we can explore to see how best we can work. So Dr. McCoy Davis, she works on retirement preparation, social care, and this is social care relating to older adults and also social policy around older adults. Mrs. Chin Bailey has an interest in occupational health, so anything relating to workers' health, whether it be mental health or any other thing. That's her area of interest. Mrs. Walters, her area of focus is on breastfeeding in younger population. Dr. Donaldson Davis is doing some work on frailty in older adults. So frailty assessment, the impact of frailty, outcomes relating to frailty in the older population, community-based older adults. Dr. Tyndale is doing anything around public health and aging, very broad area, right? And my work is around quality of care. So quality of care, primary care, whatever program area you're looking at, quality of care in terms of hospital, we're looking at patient safety, risk management, anything that impacts quality of care. So things around staffing, etc. And then a big piece of work that I'm starting up is around care coordination. So how do we coordinate care from primary care to secondary care? How do we coordinate care in terms of in-hospital care, going from department to another department? In unit, how do we do care transition, like handing over? And pre-hospital to hospital. So it's looking at the various elements of the referral, counter-referral systems, and just trying to see how that works in the general public health context. So if there is an area that you have an interest in, even if you don't know the topic, then you can always engage these people in conversation and then try to come up with something that you may have an interest, meaning to refine something that you may want to do. But remember, you're free to do whatever you want to do. All right. So then, everybody's signed like the heavy
here. You can say whatever anybody when you start to do literature review and all of the stuff.
No, so we're here to work through it with you, to tell you that no, that's too big, you need to scale back, or to tell you that's inadequate and you need to put on some more things on it. So it depends.
You have office hours?
I don't have office hours, but I don't have set office hours. You can just contact me and I'll let you know when I'm available. Oh, this heaviness, like, you guys and those big sighs falling right on me, man. Like, it's okay, you'll be fine. You just need to finish, and you will finish. All right. So start to work on your ideas. Everyone just looks so scared. Guys, it's
So I was
okay.
saying to her earlier, I'm like, we started this like ready already. Yeah,
It's okay.
I mean,
I can tell you about some of the topics that people have done, like last like last year, people would have done readmission rates in hospitals and looking at the factors influencing readmission. People had concerns about the implementation of the electronic health records. And so they wanted to find out how physicians and the healthcare workers feel about the the implementation, their knowledge of it, etc. We also had people looking at factors driving delays in terms of elective surgeries. Looking at reproductive intent among women with HIV. People looking at substance use among university students. I'm even trying to remember, I have so many adherence to medication among those with chronic diseases, adherence to antiretroviral therapy, patients living with HIV, looking at quality of life among patients with HIV. One group did knowledge, attitudes, and practices relating to emergency medical response, like first aid, CPR, so among police officers. STIs among university students. I'm trying to remember all the students.
Anything in as it relates to like health systems.
It's broad, so what's about health system management?
Said for the health management person.
Yeah, but you have to find, so like, that's a broad area.
I wanted to hear like from last year's meeting, like what they were doing as it relates to health systems management.
People looked at systems,
Well,
so
looked at
like the
readmission.
readmission rate.
Readmission.
People looked at also, people looked at, there's this student who did an ecological study around the river tongue smoke and the frequency of respiratory diseases. It's just so many topics last year. Infection prevention and control in hospitals. Yeah. They have
That
a,
sounds very boring.
tell me what you have, tell me what you have in there.
I mean, I was looking at dental anxiety on patient
You're looking at what?
dental anxiety and then how it correlates to patient management. So I had little things about it. So dental efficiency of dental procedures.
So is it anxiety or there's something called? So.
There is dental anxiety.
Dental anxiety, okay.
The finish on burnout. It causes patients to prolong or ongoing treatment.
I mean, I understand the burnout piece.
The burn, after you finish, like a serious patient, you kind of done for it.
Also, you want to look at dental anxiety from the perspective of who?
That's why I need to add it.
Okay, that's fine.
Yeah, and then for the managed dental anxiety, and then it caused like a transfer, like while they're waiting, I realized like one person's anxious, everybody's anxious.
As you see, I mean, it can, if, of course, I mean, lots to explore there because it could actually do an assessment of anxiety among patients accessing dental services.
Yeah.
And then probably look at the factors driving their anxiety, and how it influences their practice in terms of oral health. Yeah, I have anxiety because you see, if like I've booked to go to my dentist that I'm seeing, I go to her office and they're telling me somebody else and I just leave. Like,
Yeah.
like, excuse me, who agreed on this? Like, goodbye.
Walk out,
I'm going, I'm leaving. I'm sorry.
yeah,
When you've developed all that trust, it's a hard thing.
it is, I mean, for me too.
Like, don't come tell me I have a different practitioner today. It's not
It's there, you already got.
covered. So I mean, there's a lot you can explore there.
I did look at the two things, the
Yeah, that's a good topic. We've also had last year people looking at fashion braces.
Oh,
And how people use them, how they feel about them. And all.
Dr. Thompson.
Yes, Ashina?
Oh, you can hear me. Okay. I missed a huge chunk of the first research class, so I'm basically trying to piece bits and pieces of the class together. So can I please run my topic by you and you let me know if it's fine?
No, you don't have to do it now. This class is not intended for it. What you
Okay.
do is once you have your topic, if you're in a group, which I think you are,
Yeah.
then you're going to go to your group, discuss your topic, and remember now you're agreeing on a topic in the group. So once you've agreed, or if you want to explore the topics that you guys have, then we can sit down individually and go through it. But the class is not intended to go through the topics.
Okay.
Yeah. But I mean, if you just want to share, it's fine. If you want to just say it, but I also want to caution you if you're in a group that, trying to talk about your topic when other people may be coming with a topic, you may want to discuss that first and agree it in the group before you try to ventilate everything about that topic.
Okay, sure.
But needless to say, we're here and we can talk you through the topic. So like once you meet with your group, and if you want to talk through anything, we're here to help you to work through it so that you come up with a decent topic. Something that's doable.
Okay, I think I'll save it for next time then. Okay.
Sure. Yeah. Do you want it to say something? You doing a group or individual research? You want to save your topics until you go see a group? Yeah, because I don't want us to get in so deep into the topic, get so caught up in it, and then when you go to the group, they're saying, no, not this one, and then it creates a problem because you've invested so much in it. All right, but save the topics, come up with them so you can discuss it in your group.
so can I have a moment?
I mean, you can talk, but we also need to get on with the lecture. So probably after the class, I can talk to you about it.
Okay.
It's a short lecture too, so I'll be done quickly. And so that if you want to run anything by me, we can do it after we have the lecture. Reasonable? Yeah. All right, so today we're going to be talking about goals and objectives. And what we want to do, we're going to talk a little bit about study design concepts. And the only reason we're mentioning them is because we have to take them in the context of what we're doing today, but you have a full lecture next week on study designs. All right. We're going to differentiate between aim or goals and objectives, describe the characteristics of research objectives, identify and discuss different types of research objectives, and then we're gonna do some activities relating to developing comprehensive and well-stated research objectives. So with regard to study design concepts, we generally have studies that are classified as either observational or experimental. And under observational studies, we have our descriptive studies and our analytical studies. And then under experimental studies, we have our randomized control trials and our non-randomized control trials. Please give me a minute. Guys, no one has it. You don't have it.
I remember the place with an SP.
Alright, so as we try to determine how we determine what these studies are. Who's connected? Okay. There are some questions that we have to ask ourselves to determine what makes a study what it is. So when we talk about observational studies, they are really doing studies based on, what people report. So we're not actually administering the intervention. We're not in control of the intervention. So it's based on whatever people will report, right? When it becomes experimental, we're in control of whatever the intervention is. So if we want to look at the association between lung cancer and coffee drinking. So our lung cancer would be our outcome variable, right? And our coffee drinking would be our exposure. So we drink coffee every day or whenever, and we want to find out ultimately if there's an association between coffee drinking and the outcome, which is lung cancer, all right? So in our observational studies, we ask ourselves, if we're doing that piece of work, right? Do we have a comparison group? So is it that we're comparing one group, the group that drinks coffee, or the group with the lung cancer, as opposed to the group that does not drink the coffee or does not have lung cancer? So if we don't have a comparison group, then the study is gonna be purely descriptive, right? And what that means is that all we're going to be doing is describing how common lung cancer is in the group that we're studying, how frequently people drink coffee, and all the characteristics of coffee drinking, but we're not comparing groups, all right? So we can have what we call a cross-sectional study where it's purely descriptive. We collect all the information at the same time, and it can be purely descriptive. On this slide, you would have seen two things. One is called a case report and one is called a case series as a descriptive study. What a case report is you see one thing. So somebody comes in with lung cancer and they tell you that they drink 10 cups of coffee every day. You find that to be an interesting phenomenon. And so you write up about this case because you don't typically see lung cancer with coffee drinking or coffee drinking of this amount. All right. So you write up a case because this is a very interesting case and it's just one person and you're just describing what you've seen because it's an interesting case. A case series is basically a group of the same phenomenon. Say about 5 people now and you write up about those 5 people. So you typically see these people in clinical practice, or if you do field work, you would see them in the field and you write up something just describing what you've seen. So this person came, this person had these symptoms, the person was investigated, the person reported that they had 10 to 15 cups of coffee per day, and blah, blah, blah. You're just writing it, right? So you're not trying to make any association. You're just writing what you see because it is an interesting finding. But of course, when you have 5 cases, it may help you to generate an idea that, okay, there could be a link between coffee drinking and lung cancer. But in these two, well, especially in these cases, all they're doing is describing. You will see that cross-sectional studies listed on the analytical, but you can also have a cross-sectional study where you go, you do a survey, you ask people about coffee drinking, you ask people about whether or not they have lung cancer, and you just report on that. All right, so it's purely descriptive. You're just reporting what you see. You're not trying to find out if there is a difference in one group compared to another. So once we're not comparing, then the study is gonna be a descriptive study. If we have a comparison group, however, then the study becomes analytical. All right? So what are our two variables? Coffee drinking and lung cancer. That drinks coffee and choose a group that does not drink coffee, and then ultimately determine whether or not the lung cancer prevalence is different or incidence is different. Reasonable? So now that I'm comparing a group, it becomes analytical. And the type of study is going to be basically driven by the direction of the exposure outcome relationship. All right? Let's start off with a cross-sectional study. So if I go in the field and say, this is my sample, and I'm just asking, do you drink coffee? Do you drink coffee?
No, I don't.
You don't drink coffee, all right? Do you have lung cancer based on your medical history? No. You drink coffee? Yes. Do you have lung cancer? No. And I collect the information from everybody at the same time. And then when I go to analyze my data, then I'm going to categorize those people with coffee drinking and those without, and then try to see how many of them actually had lung cancer. So I'm collecting the data at the same time, and then in the analysis stage, then I'm going to put people in group to determine if there's a difference with coffee drinking group versus the non-coffee drinking group. I will say that generally in epidemiological studies, what we're trying to find out if something causes something. And an important thing is if something causes something, then whatever it is, the exposure has to come before the outcome, right? So I would need to be drinking coffee from way back, and then you would then determine if I have lung cancer in the future, right? So the exposure has to come before the outcome. So when we do our data collection in a cross-sectional study, we're collecting the two pieces of information at the same time, and so you don't know what came first, right? So as you can imagine, that may not be your best study in trying to determine. But of course, like I said, observational study, and you're just trying to determine the exposure outcome, but you're going to do it in the analysis stage, but you're collecting the data at the same point in time. All right. I will jump over to cohort studies. So with a cohort study, we're starting by enrolling people based on their exposure status. So what would this study look like? This study would mean, what is our exposure? Coffee drinking, right? So I'm going to ask the people at the beginning of the study whether they drink coffee or not. So if your answer is yes to coffee drinking, then you go in my exposed group. If it is no, then you go in my non-exposed group, right? At the time of this, at the beginning of the study, everybody should be free of lung cancer, right? And then I'm going to follow people over a 10-year period or whatever, and then find out if at the end of that period they have lung cancer. So I'm starting with the exposure. So from the beginning of the study, I'm categorizing people. I'm having a group for comparison. Those that don't drink coffee and the ones who drink coffee. And I follow you over time to see if you develop the outcome. All right. With a case control study, I'm start by enrolling people based on their outcome status. So what is my question to you at enrollment?
Yeah.
You have however we're going to determine it. So if it's by hospital diagnosis, we want to categorize the lung cancer people in one group and then the non-lung cancer people in another group. And what we're doing is asking, did you drink coffee in the past? Some people will say yes, some people will say no. So for analytical studies, right, and these are the study designs. The name of the study is going to be dependent on the direction of the exposure. So if you collect information on the exposure and the outcome at the same time, what kind of study is that? A cross-sectional study. If we start by enrolling people based on exposure status, the exposure yes or no, and follow them to see if they develop the outcome, what kind of study is that? A cohort study. And if we start by enrolling people based on their outcome status, then ask about their exposure, then it's a case control study. Simple? Or you want a minute to catch your thought, catch your everything, catch your breath. For those who are just walking in. People online, how are we?
Good.
We're good, or I'm good.
Good. Right. So, I mean, we have a whole class on these individual study designs, but I want you to get the concept, all right? So, remember now, so these are observational studies. So we don't control the coffee that you drink. You're just reporting to me that yes, you drink coffee. I may quantify by asking you what is the number of cups of coffee that you drink per day. You're telling me. In the same way, I may be asking, about cigarette smoking and lung cancer. I'm really gonna be asking you about your smoking status, right? So that makes it an observational study because I'm not in control of the coffee that you're drinking. But where it becomes experimental is that I'm in full control of what you're getting. So if in an experimental study, I'm controlling the coffee that you drink. So I'm going to say that, okay, you are allowed in my study. You're gonna be part of a treatment group, that is what we usually call it, or an intervention group and a control group. So, right, so like a clinical trial. So in my control group or in my intervention group or treatment group, I'm going to control the concentration of the coffee, the amount that you drink per day, the frequency, right? So whatever it is, the caffeine concentration, I'm going to have total control over that because I also want to ensure that everybody gets the same thing, right? While the other group may get what we call a placebo or just no coffee at all. We probably give you decaf, right? So you probably get something that tastes like coffee but is not coffee, right? But I am in full control of the intervention when it becomes experimental, right? And the question that we need to ask them to determine whether it is a randomized control trial or randomized, well, that's what it's called because, or randomized or non-randomized control trial is if we randomly allocate people to groups, right? So there's this process that's called randomization, which you're going to learn about. So if we randomly put people in groups, exposure group versus non-exposed group, then it is called a randomized control trial. If we don't randomly allocate them, then it is called a non-randomized control trial. If we don't randomly assign them, there is more room for bias and all of that, right? But the simple question, if we randomly allocate them, it is called randomized control trial. If not, non-randomized control trial. So observational studies, we're not in control of the intervention, right? If we have a comparison, if we don't have a comparison group, then it's a descriptive study. But if we have a comparison group, then it becomes an analytical study, and we can have a cross-sectional study in which we collect the exposure, the information on the exposure and the outcome at the same time. But when we get to the analysis stage, then we put people in group and compare. If it is a cohort study, we're starting by enrolling people based on their exposure status. So the coffee drinking, yes or no. And then over time, follow it to see if you develop lung cancer, yes or no. If we're doing a case control study, we're starting by enrolling people based on the outcome. And in our example, the outcome was lung cancer. We're enrolling lung cancer, yes or no, and then asking about the outcome. when the study becomes experimental, we are in control of the intervention. All right? So we have everything. So we know the concentration, everything, right? And we're enrolling people, usually based on the exposure status. We're enrolling based on exposure status, then determine if whatever it is that we're looking at is going to contribute to the outcome. If we randomly allocate people to group, then it becomes a randomized control trial. If we don't randomly allocate them, then it becomes a non-randomized control trial. So that in essence is the study designs. You have case control, so you have your case report, your case series. Of course, you have an ecological study, but that's kind of a different, because that's group level data. Then you have you have your case control study, cross-sectional study, cohort study, randomized control trial, non-randomized control trial. Those are your studies. So you're ahead in terms of learning your epidemiological studies. Reasonable? All right, we're getting there. Slowly. You could have just say yes, you know. All right, and just to point out in terms of the level of evidence, at the base of it is expert opinion. So you ask somebody who's working in the field for forever, and they may note some things, you ask for an opinion. Of course, it forms part of evidence. Remember, when we look at evidence-based practice, we spoke about the expert opinions and its importance in forming or practice that's informed by the evidence. So an expert opinion is at the base.
Pull it, 90. 90, pull it.
Then we have our case report, which is identifying that one case, describing what we see. And then we have the case series would follow, because the case series would be a collection of the similar cases. It's not on this diagram. Then we have our cross-sectional study, and the feature of the cross-sectional study is what again?
Oh, the outcome when they.
We are collecting the data on the outcome, exposure at the same time, and we're looking for differences in the analysis stage. And then the next level of evidence is our case control. Right? And what we're doing there? It starts by enrolling people based on their outcome, and then ask us about their exposure. And as you can realize, if we're enrolling people based on outcome and then asking about the exposure, you know, the challenge that we're having is that we don't know what came first, right? The exposure and the outcome. Right. But if we use new cases, like newly diagnosed cases, then it gives us a little more confidence. For example, that the exposure came before the outcome. In a cohort study, we're enrolling based on exposure status, and then we're following people to see if they develop the outcome. And then we have the non-randomized control study, which is what kind of a study? Experimental study. Enroll based on right. So we enroll based on exposure status, but the people are not randomized to groups. Or randomized control trials are experimental, just the same. We're randomized to their intervention groups. And then we have systematic review and meta-analysis. So systematic review and meta-analysis would be looking at multiple studies that measure the same exposure outcome. So we know that we may have a study in Jamaica, we may have a study that is done in another country, 20 other studies done in the US, and we want to see what are they saying about this relationship, right? Are the results similar or do they deviate? And so we would describe all the studies to say this is the position that people are coming up with, or these are the findings of the studies that we're looking on relating to coffee drinking and lung cancer. Now, a meta-analysis is really just a statistical analysis of all these studies that you do in the systematic review, and you come up with what we call a pooled analysis. So it is going to say, with all these studies considered, of course, the bigger studies will have a greater weight. And this is the pooled position that you're more likely to have lung cancer if you drink coffee. Or if you're 5 times more likely, we'll quantify it and give you a number. While the systematic review is just saying, overall 20 studies showed that there was a positive association, while 10 studies said, no, there was a negative association. If all the studies are showing a positive association, then you may not need a meta-analysis because you don't know the direction. All right?
Question of them, so
Mhm.
for the systematic reviews and meta-analysis. It's always RCTs, or it can be any one of these here.
No, it can be other observational studies, but with a systematic review, then typically you want to have good data, high quality data, and the high quality data is typically gonna come from your clinical trials. But of course, you can do a systematic review of observational studies, and it's fine. Right? But it may be hard if you're doing a systematic review and then to do a meta-analysis from observational studies, because the studies, the characteristics of the studies, they may be so varied. But you can do it with your the systematic review with your observational studies. So that's for you to understand study design. So are we clear? Do we get a gist? Because that's really the gist of the study design. Are we there? No one, no push-up notes in here.
Yeah.
Who wants to take a jab at it before we move on? The different study designs.
I'm gonna give us a scenario.
Mhm.
Can you read from this?
You want a scenario? All right, so let's look at class attendance and exam passes. Or good performance in exam. So class attendance. And I'm putting on your spot them. I'm even giving it extra work in terms of your categorization of that class attendance. So and passes in exam.
So it would be, there are 2 groups already.
What are those 2 groups that you have already that you didn't tell me about?
Alright, so you have a group that attend class, rate, I guess, regularly.
So I'm giving you a scenario for you to tell me how you would apply all the different study designs. So what would the cross-sectional study look like? All right, let me give you an easier example. So let's talk about smoking and the development of heart disease.
The exposure would be smoking.
So the exposure would be small.
I mean, also means cardiovascular disease.
Yeah.
Maximum should be more about, could be, but it could be
No. We're using that scenario. So probably I should put you on the spot and say, tell me what a cohort study looking at, what I said a while ago?
Heartbeats.
So tell me what a cohort study would look like using those 2 variables. You just tell me about the cross-sectional study, and I'll pick somebody else to tell me about case control, or somebody wants to volunteer, and somebody can tell me about cohort, somebody can tell me about a non-randomized control trial, and then somebody can tell me about a randomized control trial.
Alright, so. So it will be an observational study, right? The comparing.
Cross-sectional, so cross-sectional.
Cross-sectional, I'm doing.
You focus on
Oh,
cross-sectional.
cross-sectional, okay. Alright, so. Basically, wherever you're finding these people, whether in a primary care setting or wherever, hospital, you're basically asking them, do you smoke? Do you have heart disease? Do you have a heart problem? Some will say yes, they smoke, some will say no, they don't. And they have, yes, I have heart disease, no, I don't have heart disease. And then, so I'm collecting all that data at the same time in the clinic. I'm asking everybody the survey questions. Then when I'm analyzing, that's when I would have to maybe disaggregate the data to say, all right, these are the ones who smoke and have heart disease. These said that they didn't smoke, but they have heart disease. These don't smoke and don't have heart disease, and vice versa.
Okay,
So I
good.
want to know who would start smoking first and get heart disease after. So,
Very good. What's take on case control? Should I call names? So case control, the person is starting with a disease.
Okay, Dr. Thompson, this is Carrie. I'll have a go.
Carry somebody in the class answering. I'm waiting to
oh,
submit,
sorry,
but
sorry,
you can
sorry.
have the go at cohorts. I'll let you know when to go, okay? So finish up. Remind me of your name, because I need to learn the names as well. Veronica, yes, Veronica. So in one group you have, and in the other group, persons who don't, okay, and then you want to ask them about their smoking history. All right, good. Carrie? Cohort study?
Okay, for the cohort, you'd have a group of persons. So in this case, maybe persons, all of them are smokers. And then you would follow them over a period of time to see if they develop heart disease.
So the exposure, they're gonna have a group that does what?
A group that smokes and a group that doesn't smoke.
Right. And remember, an important thing is that at the time of
Yes.
at the time of exposure, they should be free of the lung
Okay,
cancer.
okay.
That's very critical.
All right, so they should be free of heart disease. And
Right,
then over time,
Yeah.
you would see if the smoking versus the not smoking.
right.
Positive, okay. Thank you, Dr. Thompson.
All right. Randomized control trial.
Get a group of persons and you put yourself for so that you have two sets of groups that you can have control over getting. Then you have one group, you give them, well, none of them smoked before and none of them had the condition. Then you give one group cigarettes to smoke.
Right.
And then the other one, give them a fake vape and
No, vape is not a good example. We'll give them something else.
something else.
Right.
And then you study them over a period of time and see what group.
Develop their heart disease or who, because you can develop a heart disease and smoking could be, it may not be a factor. They're non-randomized. Let us don't randomize the people into the group, but you still do the same thing. Give them the cigarettes and a group that will not get, and then you follow them. All right.
So if you don't randomize them, how are you going to like?
No, so randomized is where you'd use a process that will
That's true.
ensure that each person has an equal chance to be selected to go in a group. Now, when you don't randomize, what it means is that I may look at you and say go in the group. So if you don't randomize people to groups, then you introduce fast. Because I could have put in everybody in one group that would have the heart disease anyway.
Right.
Because of other factors, but I push them in the group and then I want to blame smoke. Sorry, so it could have been your characteristics as an individual. So when we randomize, we basically balance out the risk. Right? Make the group similar. All right. Let's go to the meat of the matter. So this is just for us to understand the whole concept of this analytical piece and the descriptive piece, so that when we start to think of our goals and objectives, we'll be able to, contextualize it. So so far in our research methods, we've spoken about just why we do research, identifying a problem, writing a literature review to justify why we're doing the research. And so now we need to show the direction of the study that we're going to do. And so with that, we have to come up with our aim and objectives. Reasonable? So that's gonna tell us where we're going. So Major said, if you don't know where you're going, it's difficult to select the suitable means of getting there. So we always have to be very clear about what we want to achieve in a particular study, which is why we have to ensure that we know that the problem or define the problem very well so that we know where we want to go. All right? Sorry, Cindy. So the aim or goal is a general statement of what one expects to achieve within a given time frame. It tends to define the ideal and is very abstract, not highly specific. So for example, we want to determine or to document the current health practices of postmenopausal women in Jamaica. You see where I'm going? But it is very broad, right? But it is also fine. So to determine the current health practices of postmenopausal women in Jamaica. So what do you think we'd have to develop further as we look at the objectives? So what's health practices? So we may have to be very specific now, you know, to determine the dietary practices, the physical activity, among many other things. So, but we cannot put everything in the aim and in the aim or the goal. So health practices would cover a range of things, but of course, we're gonna have to develop that further. All right? Someone was asking a question? So the objectives, though, are more precisely stated, the precisely stated ends to which the efforts are directed, or the specific ends capable of both attainment and measurement. So whatever you're going to write, you have to be able to measure it. So if we want to measure knowledge, how are we going to measure it? If we want to assess attitudes, how are we going to measure it? If we want to assess practices, how is it that we're going to measure it? Right? And it is basically a breakdown of the aim or goals into smaller, logically connected, measurable parts. So you will see that for your objective, they must be smart, and I'm sure you've heard this. So they must be specific, they must be measurable, they must be achievable, must be relevant, and they should be time-based. All right? So by specific, they should be clearly phrased, unambiguous, stating exactly what is intended to be done, covering all aspects of the problem coherently and logically. It should also be measurable. You should be able to measure whatever you set out to measure, right? Anything that you want to measure, you have to find a way to measure it. So as you start to write, ask yourself, how am I going to measure this? All right? And if you can't measure it, you just leave it out. And then soon you ask yourself, you can't measure it reliably and valid, and using a valid measure, then I'm going to leave it out again. Because how do you say? So if you say you're assessing knowledge, is this a valid measure for knowledge? How do I know that I'm really assessing knowledge? And what you find sometimes, even on the face of it, people are really assessing awareness, and awareness is not knowledge. Right? So you have to keep asking yourselves, is this measuring what it says it's going to measure? Right? So, you know, have to start thinking about what questions will answer anything that I write. All right? It should also be achievable, so meaning feasible, doable, considering the resources that you have and the local condition. It should be relevant, useful, necessary, and important to the overall stated goal and to public health or practice in general. So again, you don't want to go do something that's not relevant. And of course, we need to state the time in which we're going to be doing the study. So, or whatever it is, to understand the practices over a 1 year period, or for the period 2022 to 2025, whatever it is, we need some time in the objective. So the specific objectives will systematically address various aspects of the problem. So the nature, the distribution, the size, the intensity, the associated factors, the relationships between problems and factors, and then the expected outcome. When you're writing your objectives, you want to ensure that you don't use terms that are not concrete. So when you write to learn, you're not very specific, or to know, or to understand. Those are very broad. To understand fully, or to appreciate, or to be aware of, or to realize. Those are not very concrete terms. So you want to use more concrete here, and this is not an exhaustive list, like to determine, to identify, to discuss, to classify, to evaluate, to compare and contrast. So concrete terms for your objectives, rather than writing something that people may ask you, what do you mean by realize? You know? So this is an example of some objectives around the goal of this study, which was to examine the sexual and genital urinary health of middle-aged and older women in the context of active aging, including the attitudes and experiences of urologists and gynecologists in relation to the provision of sexual and genital urinary health. Now, this aim, our goal is very long, simply because it was a big study capturing two separate components. So the first one, they wanted to examine the sexual and genital urinary health of middle-aged and older women in the context of active aging, right? And then the second one, if you wanted to write them in 1 and 2, is to determine the attitudes and experiences of urologists and gynecologists in relation to the provision of sexual and genital urinary health care. All right? But this is because it was a very big study, somebody's thesis. They had to incorporate all elements in the aim. And so you'll find as well that if you write objectives, the objectives must always be linked back to the aim. So you're studying two separate populations here. And so what will need to happen is that you capture both in the aim. So the first objective is to determine the prevalence of pelvic organ prolapse and urinary incontinence and their association with sociodemographic characteristics, reproductive history, chronic disease status, menstrual status, and social engagement among women 50 years and older. And what is missing from this is a time period. I'm not going to ask you to critique. I'm just showing the examples of how they develop things around the aim. The second objective was to describe the relationship satisfaction and sexual engagement among women 50 years and older, to describe the relationship between sexual engagement and sociodemographic characteristics, chronic disease, pelvic floor disorders among women 50 years and older. And then they wanted to explore the perception of the experiences of women aged 50 years and older in relation to aging and sexual and genital urinary health. And this is a qualitative objective, which we're going to talk about separately. And then to explore the views of doctors, which is now bringing in the last part of the goal, to explore the views of doctors regarding the delivery of sexual and genital urinary health care to women 50 years and older. So these objectives, and that's because they didn't want to write 10 or 15 objectives, they would have combined them. Because here, if you are writing, then I'm going to tell you that your first objective is going to be to determine the prevalence of the pelvic organ prolapse. So that's number 1 for you. And then number 2, you're going to go on now to determine the relationship between the pelvic organ prolapse and whatever factors. So at your level, I will be asking you to break it down further as I'm going to show you in some examples. But I show you all of this because we're going to come back to look at it to find out what's descriptive, what's analytical.
If that's interesting.
Uh-huh.
From the age,
Mm-hmm.
when you said middle age and older, I'm assuming they start with middle age from 50.
Right, so they would need to now operationally define what middle age means. So after you write the aim and objectives, you're gonna have a section called operational definitions. To specify that middle age means 50 years and older in the context of this study. Or if you're using based on global reference, then you're saying according to whatever middle age is classified as that, and so this is how you're going to treat it in the study. So you have descriptive objectives and you can have analytical objectives, right? As you can imagine, similar to study designs, if you're writing a descriptive objective, you really just want to be finding out the who, the what, the when, the where, the how much of a particular phenomenon. So they're usually easily stated. So to determine infant mortality rate in Jamaica in 2012. So all you're going to do is calculate it how many infants died over the live birth, and you will report that for 2012. You're just describing it, right? Or you want to determine the average birth weight of babies in Guyana in the period July 2012 to September 2012. Simple. You just have to state it, huh? When they do it. And so even if you're going to be reporting the average birth weights, what they have in Guyana, I mean, we have parishes, what they have in Guyana, I don't know. Let's say, for example, parishes is what they make reference to in Guyana. You could also determine the average birth weight of the babies born in Guyana by parish. But all you're doing is reporting the average birth weights. That's all we're doing. We're calculating and we're saying this is it. That's all, right? Now, when we go to our analytical objectives, we're talking about the why and the how. So the researcher is seeking information if there's an association between variables, right? So remember when we spoke about smoking and heart disease, what would be our analytical objective? Is there a relationship between? And so what do you notice from that analytical objective? We're seeking to compare, find differences in groups. So in the same way with our analytical studies, right? When we write analytical objectives, then we're seeking to look if there are associations, if there are relationships, if there are differences, right? So we're comparing a group to another. So the independent variable, so an independent variable is our exposure variable. So in the context of smoking and heart disease, what is our independent variable? Smoking. So independent variable is our exposure variable. Our dependent variable is the outcome, right? So an example then of an analytical objective is to determine the association between infant mortality rates and health region. What are we doing? We're comparing the rates. So we're finding what is the rate in Sarah, what is the rate in Western region, what is the rate in the Southern region, what is the rate in the Northeast region. And then what we do is to look statistically if these differ. So we're going to apply a statistical test and to see if they differ statistically. And you don't worry, you're going to learn it in your biostats and you enjoy it so much. And when you come over here now, that's what you're going to apply, right? So you're going to now look if the differences are statistically significant. Or you may want to compare the incidence of fall between postmenopausal women with low and high physical activity, right? So you're comparing. So once you have comparisons, then it's gonna become analytical. All right? All right?
Yes.
So we have either descriptive or analytical. And all we're doing is comparing groups. So in research, we know that we can have variables that we call confounders or what we call effect modifiers. So remember, we were talking about the relationship between smoking and heart disease, but what other things do we know that can influence heart disease? Right, lack of exercise, genetics, all of those things. So those variables could confound, means obscure the effect between smoking and heart disease, right? So sometimes you may write an objective which is uncommon, but you can still do. And I mean uncommon in the MPH. Nobody is stopping you from writing them. But just so you know that you will see people write research objectives to look at the other things that may influence their outcome or the association. So in this case, you want to examine the association between infant mortality rates and health region while controlling, and when we say controlling, for maternal age and gestational age, we're saying these are potential confounders. So these may influence the relationship between infant mortality and health region. So with controlling is just whatever mechanism we're going to use to say that these variables, we don't want them to influence what we're finding. And again, that is statistics that you will learn, right? So you don't have to worry, but when you see these objectives, it means that we want to not allow the maternal age and the gestational age to basically influence the relationship between the infant mortality and the health region. You want to purely see how they relate, the infant mortality rate and the health region. And we do those things statistically, right? Or you may want to compare the incidence of falls among older adults with low and high physical activity, holding age constant. So age may influence falls. Age may also influence physical activity. So when we say we could say controlling for age or holding age constant. It is identifying that those variables may potentially confound the effect. And so you want to ensure that you control for them so that you see the true relationship. So not that you'll be asked to do this, but if you see them in literature, you understand what it means. All right? So a lot of people may ask, what is a research question? What about hypotheses? Do I need to write them? And there are varying schools of thoughts. So like when you submit something to the ethics committee, they write it back and say where are the hypotheses and where are the research questions. Really and truly, do you need all of them? You see at the end, it depends on who and what you're writing for. Because sometimes some people write and ask for them and you just give it to them just because, not because they're needed. Because with a research question, right, you just write your objective in the form of a question. So we're writing to determine the association between infant mortality and health region. What would the research question be? What is there? What is? And then you put a question sign at the end, and that's it. So you really don't need to be writing a series of objectives, then go and ask the thing in a question. In the same way, right? So over here, we're not writing the two of them. If you see things.
Please try to stay closer to the mic, please.
Okay. I didn't move though, but let me stay closer to the mic. So in social sciences, you see them write both objectives and research questions. Sometimes you see them all at the hypotheses. Now, just be on the lookout, like if you send a proposal, if you're a social scientist reviewer, looking at it, they may send back to us. And it depends on the supervisor, they may accommodate it or they may write them back. All right. Sorry, Wasim. All right. So about the hypotheses, I'm gonna tell you about how to write them.
Or, when you have then a research question. You. Then,
A general one in terms of the aim.
and then the objectives are picked out from the.
So you can write the aim in a question form, but it's usually a statement or a sentence that you're writing for your aim. Right, but you can write your goal you can write a general question, but you're gonna still have to develop the objectives either in a question format or if you're writing statements or sentences, whatever it is. But generally, we write the aim in sentence form. The objectives, you can write them in a question form or the sentence form. It's really up to you because they should be saying the same thing. So, as with the sentence form of an objective, the analytical objectives can also come in hypothesis format, right? And when we talk about hypotheses, we're basically trying to test whatever it is that we're proposing. So by about week 5 in biostats, you start to test hypotheses with various statistical tests, right? So in this example, remember what our analysis was, our analytical objective was to determine the association between health region and infant mortality rate. When you're writing your hypothesis, you're making a statement that you're going to test whether it's true or not. You have a question or you just saying? So a null hypothesis would say there is no difference. A null, no difference. There is no difference between infant mortality rates in health region A and health region B. So what we're going to do is to go out and try to test this. But usually you have an alternative hypothesis where you're now taking a position. And the position is that the infant mortality rate in region A is higher than in region B. So I'm now going to test that to see if it's true or false. When I test it, I can accept the null hypothesis that there is no difference or reject it. And you're going to learn how to do that in biostats. You test hypotheses, but this is how you write them. You write a null hypothesis stating that there is no difference. When you write an alternate hypothesis, you're taking a position that there is a difference between whatever and something else. It has to be testable. Right? It no make no sense you write something that you can't test. All right. So let's look at our first activity. So this is my first objective, to study the effects of vaccination against measles. What is your critique of this?
Where are we doing?
It's vague.
It's vague. So let's use the SMART thing. So it's not specific. Is it measurable?
No,
Why not measurable?
there's no sense or.
There's no,
What do you say, Alex?
there's no unit.
What
or-
effects is it trying to measure?
Yeah,
Right, so because it's non-specific, we can't measure nothing. That's what we're saying? And I can't be wrong and strong or just be
Yes.
very wrong.
Yes.
Be very bold and correct. You know? Say it with your whole chest, man.
Yes, it has non-specific goals or aims really.
Can't measure it because we don't understand what they want, all right? So, but largely because we start out with it being so vague, then it becomes problematic. We also don't have any time. All right. So my aim for this study, I want to assess caregiver burden among persons caring for older adults in Jamaica. So caregiver burden can be assessed using an instrument that can categorize people as have been burdened or not burdened based on the score that they get for information purposes. So I want you to attempt writing one descriptive objective, and you can feel free to write what you want to write. One descriptive objective, one analytical objective, and one hypothesis. So take a job at that. I'm coming to look at your papers. And people online, please send the private chat to, let me tell you what. To presenter. To write one descriptive object, and you can choose what you can choose whatever. You can develop it how you want to develop it, but my overall aim is to assess caregiver burden among persons caring for older adults in Jamaica. So let me see how creative you are in coming up with some objectives. All right, guys, in the chat, I've read through all of your stuff. All right, I think the attempt that you all made was very good. As you start to write, you know, you will realize that some of the writing may not be so very direct, and some of it you may just have to tighten up. But by and large, I got that you got what a descriptive thing should look and sound like, but you would just need to tighten up some of the statements. So for this, so if our aim is to assess caregiver burden among persons caring for an older adults in Jamaica or older adults in Jamaica, so some people would want to determine the proportion of people who are categorized as burdened. I mean, we're completing the statement to determine the proportion of caregivers who have caregiver burden among those caring for older adults in Jamaica. I saw somebody write to determine the mean age of caregivers caring for older adults in Jamaica. Others wrote, lots of people wrote about just categorizing the burden, which is fine. In terms of the analytical objectives, those were okay generally. Again, would want to tighten up, but always remember that you're trying to compare a group. You're trying to compare groups in your analytical objective. So let me read one or two from the chat. So to examine the relationship between caregiver burden and the medical conditions and health status of the older adults being cared for in Jamaica, of course, I would want to just say we'd have to tighten it by, you know, just saying to determine the association between caregiver burden and the medical condition of the older adult. Like, just try to make it, you know, like that is what you're doing. Of course, health status may need to be further defined, but, or, you know, you probably just want to separate them because health status could, you know, the medical condition piece could fall under health status. So you want to be as specific as possible. Another one to compare. This is compare the cost, the associated cost of care. But we're not sure what is the group that is being compared. So we need to specify the group to I'm trying to find somewhere. One person wanted to compare to determine if there's an association with caregiver burden by area of residence being rural or urban. Somebody wanted to find out if there was an association between caregiver burden based on whether the care recipient or the older adult was mobile versus not mobile. And so you can see the easy comparison. Yes, Dan, hi.
Yes, Doc. I didn't get to post mine. I wanted to share.
Go on now.
May I? I'm going to share my analytic objective and my hypothesis. So to determine the association between caregivers burden and health outcome of persons 60 to 70-year-old in Jamaica for the period January to June 2020.
Nicely written, but what is the health outcome?
Assuming, well, that they'll have improved or some amount of better control, depending on what we're looking at. So I need to be more specific.
I mean, if you want to say health outcome, and for this study, health outcome will be assessed using these measures.
Right.
But you would need to specify what those are.
Okay. All right. So my
But I
hypothesis.
mean, apart from that, it is fine.
Okay. I did an alternate hypothesis to say the health
So me know why
outcome.
you tell me. Me want you tell me the null first.
Oh, I didn't do the null. I'm sorry. I do it now.
No, but you don't need to write it. All you gotta say there is no difference between whatever the alternate hypothesis variables are.
Oh, okay. So there's no difference between health outcome and the burden of person's health care. I'm sorry. There's no difference between health outcome and the burden of caregivers.
You forgot to tidy that up, but
I thought so. So the
you got the
alternate,
objective for me? Sorry.
the objective,
Mm-hmm.
determine the association between caregivers, burden, and health outcome of persons 6 to 70-year-old in Jamaica for the period January to June 2020.
Just reflecting that health outcome piece. I'm talking about just linking. So caregiver,
Mm-hmm.
like that, whatever that health outcome measure is, may be very difficult.
Okay, so I need to be more specific.
Right.
Okay.
Because they really made, if we're talking about outcome, so we may want to look at another characteristic of the older adult to compare.
Okay.
Because yeah, the outcome, just that the outcome thing is a little problematic.
Right, okay. I understand that.
Yeah, but if you choose something else, so if you want to determine caregiver burden, the association between caregiver burden and the presence of chronic disease of people, of the older adults, then you can take it down that line. So you would, of course, be comparing the older adults with chronic diseases or those without chronic diseases versus the caregiver burden. Then,
Right.
yeah, but the health outcome piece is problematic.
Thank you, that's good.
But then we'd follow through with your hypothesis then, if you're doing with the null hypothesis, to say that there is no difference between caregiver burden and chronic disease status of the older adult. And then in your alternate hypothesis, you may want to suggest that there is a persons with the alternative hypotheses.
All right.
So caregiver burden is higher among those who take care of people with older adults with chronic disease compared to those who do not have.
Right.
Right.
Okay.
So that is a general idea around the descriptive objectives, analytical objectives, the hypotheses. And I never realized I said one hypothesis, and there are stressing out about with the alternate hypothesis and the not. My sincere apology, right? I thought I said hypotheses. All right. All right, guys, that was a very good attempt. Just that as you write, you'll be able to write a little tighter so that the thing is, a little more concrete. All right, so sometimes you may see, especially for your interventional studies, that you can write in what we call a PCOT or PCOT format, in which you define who the population is, state what the intervention is, state the comparison and the control, and say what is the outcome or desire, or what is of interest, and then the time period. So you can write your research question or objective in that format, or sometimes if you see that people will write a goal, their research aim or goal in this way, especially for the interventional studies, all right? So in adults with total hip replacement, all right? So that is our population. How effective is pain medication? So the pain medication is going to be the intervention. compared to aerobic stretching, which is the comparison in controlling post-op pain, post-operative pain, which is the outcome during the peri-operative and recovery time. So that would be our time period. All right. So you're stating what the population is, stating what the intervention is, stating what the comparison is, the outcome, and then you put a time period. So sometimes you may see people write the objective in this way. So just some final words on objectives. So all objectives together must fulfill the aim or the goal of the study. So when you're writing, everything that you have in your objective, for example, well, one, you should have it covered in your literature review, and then you must determine how you're going to answer all those objectives in your study. So as you write, if you want to determine the socio-demographic characteristics of caregivers, how am I going to answer that? So some of the questions I might ask to answer that. Socio-demographic characteristics of caregivers. I'm asking about age, education, gender, age, although you said age, income, right, education, etc., marital status, right? And then we want to determine caregiver burden. How do we determine caregiver burden? We're going to use an instrument. An instrument consists of 20 questions that cover X, Y, and Z until we do whatever. So whatever it is that you're writing, just ask yourself, how will you measure? All right? And always remember that any fool can answer a question. The trick is to ask one that can be answered. And this is really a serious thing, because a lot of times you'll find that you're writing your objective and you don't have a clue about how you're going to answer it. So if you, in your head, cannot determine how you're going to answer, you nobody write it. Seriously. All right? All right, so that's a wrap for today. Do you have any questions? All right, so I don't know who
Sorry.
came late.
No, it was more so just I want to say like a quick question regarding the idea of a descriptive. Like give an example of how the descriptive question would have been framed.
To determine the prevalence of caregiver burden among caregivers of older adults in Jamaica. So we're gonna do an assessment and describe it, or we want to describe the socio-demographic characteristics of the caregivers in the study. So then we'll be talking about what is the mean age, what proportion is male or female, area of residence, what proportion live in rural versus urban, things like those.
Thank you.
All right, so for those who came late, we did a group allocation, but it was in group for your consideration. So you can take note of it. Is Tashai here? And Tashai, you want to do a group research or individual research? Group? You're full-time or part-time? You're in which track?
Health promotion.
And Melissa Richards. Melissa, you're here?
Yes, miss, I am.
All right, so you're part-time and you have health promotion, health education, just the same, right?
Mm-hmm.
So you guys are fine working together?
Yes, we can work something out.
There you go. So we have 18 projects, 7 groups, 11 individuals, 18 projects. So guys, yeah, 18 of you guys, okay? So Oh, Lord.
Maze, if there are adjustments to the group, we can let you know still, right? 'Cause even my group with the 2 persons, suppose persons from the individuals would want to join the group, that would be okay?
Of course.
All right, so my group might be adjusted, so I'll let you know if there are any changes.
No problem.
All right.
So this is it. I'm encouraging you to meet with your groups. Please remember that your first presentation is next week, Thursday, and you are presenting on the problem statement.
Will there be questions?
Hmm?
There be questions?
Oh, holy, what do you mean? The whole point of the presentation is that we're gonna critique. You will need a PowerPoint.
And we present it as the group or the individual.
Right. Can you imagine that's 18 presentation?
What's the recommended time frame?
It's 5 minutes. Thursday. That's when the presentation will be
For the problems,
for the problem statement.
just the problem.
Just the problem statement. So you're coming up here with about 6 slides or 7. So you're going to give us your topic, state the problem. I remember the build up. Then you're going to put some points in terms of the justification based on what you've seen in literature, relating it to your audience. That's it. Good? It's not so serious, guys.
It's so.
The sample, like what I have in the Word document, you could convert that to a PowerPoint. So use that as a guide. Yeah, man, I'll come to you eventually. Good? So remember now, the problem statement has a 10% grade allocated, but it's more so for your delivery and for the group involvement if you're in a group. So the people in a group will get something to score the other people to talk about their contribution. So the people not contributing, then don't get the grade. And people who are not registered for the course, please remember to register.
So this problem statement now is we're just gonna elaborate that for the final research paper.
So you're building.
Yeah.
So if you come up with a problem for research, then we're building on that. So you will find, and the next lab is going to be what are your goals and objectives based on what you've identified. And then after you do that, we're gonna move on to what study design you're going to be using and what sampling strategy to recruit people for the study. And then we're going to go on to a whole different thing about recruitment and consenting procedures. So we're just building. And then, though you're not presenting as a lab, of course, you're going to now go on to develop your questionnaires and whatever it is you need for that. And all of that will translate into your research proposal. So the purpose of presenting is for us to help you through all of it, to just work through, clarify. So I'm not the only one who'll be here. You'll have other faculty members listening and providing their critique.
This got serious real bad.
I told you, I told you that we're moving quickly. So by end of next week, we're 6 lectures in. And then next week, we'll have intense teaching. But after the lecture, I'm gonna say, boy, is this the time? No need to scare you. It's all gonna be fine. Yes, Alicia?
I'm saying, just for persons like myself in the back of the class, could you just go through again what the problem statement, the format it should take for the PowerPoint?
All right, so you're going to, right, so if you look on your OUR Valley, you'll see a sample, but it's in a Word document. So you're going to basically state the title, right? Just follow the flow. The title, the statement of the problem. You're going to talk about the justification, and the justification will include any gaps that you find in the literature that you may want to address, and then relating it to your audience. So doing this study will help to, help with tailoring strategies towards whatever. So we just want to know why you want to do it, give it some context. So that's really it. Your title, a statement of the problem, a brief justification, and relating it to your audience. And the justification is a preliminary literature review.
Okay, to follow up on that, thank you so much. For the preliminary literature review, how extensive are you expecting this to be? Like maybe 4
No, it's
papers,
not
5 papers?
No, so you do some background reading. You can decide, because the truth is 4 or 5 papers could be a citation for 1 point. So it depends on what is out there and what is contained in a paper that will support or justify what the point that you're trying to make. So just read, but you don't need to be providing more than 2 to 3 slides on the justification, but it is to make the case about why this is important, and just to show us why you need to do it in the context of the literature.
Okay, and then finally, so basically we're supposed to have a slide with the findings from the literature review, a summary of our literature review, plus the referencing, etc. at the end of it.
Yes, you
right?
need to put the reference at the end. So you need to start coming very good and make sure that you have the references and everything, your in-text citations on the slide as well. So you start off very good. Right. Thank you for pointing that out, Alicia. But yes, that's it.
Okay, thank you.
I come in with slides that are nicely put together as well.
Okay, thank you so much.
Thank you. Nicole? Nicole?
So each group will need to be, and
Sure, like between now and tomorrow. Just tomorrow, guys, that you need to be meeting, I told you, I'd say I'm managing expectations very well. All right? All right. So meet up with your groups, share contact information, and get going.
Anybody want cameras on? Oh, nervous.
All right, guys, so in a bit. Right.